Hey, this is Mark Carmerdall from the Brain Gauge channel, and I just want to talk to you about the Brain Gauge metric focus. Focus is a pretty important score to keep an eye on. You know, if it's sometimes if people test poorly, and you take a look at their focus score is really bad. They may be having trouble with the other tests just because they're having trouble focusing or because they're distracted. So it's really good measure just to sort of see it's sort of a litmus test to see how they test. Uh, Basically, let's look at the Brain Gauge app, and again we're looking at this data point, the data from this data point on this trend, and we come down here and here's the focus score. This person did very well. Well, the focus score comes from reaction time variability. This reaction time variability says the score is 9.1, and that means 9.1 milliseconds is their reaction time variability. The normative values for reaction time variability are in the 5 to 20 millisecond range. So that's pretty doggone good, but basically smaller numbers on this score are better. And obviously on the focus score, bigger numbers are better. So at 100%, your reaction time variability is very, very low. The lowest we've ever seen, I've seen 0 one time. But most people that do really well are in the 5 to 15 millisecond range. And then most people are in that 5 to 20 millisecond range. So anyway, where does reaction time variability come from? And it's important to know that because it gives you a good idea about just, what the heck it means. Well, reaction time variability is derived from the reaction time test. And if you're looking at this, you're probably familiar with the brain gauge and the reaction time test when you take it from the brain with the brain gauge. And you'll notice that each time you take the test, your score, which is your reaction time in milliseconds, pops up on the screen. And so let's say for test 1, the first trial that you take, it's get a 200. And then the next time you see a 200 pop up, and the next time, and the next time, and the next time. Well, if you get the exact same score every single time, then your reaction time variability would be 0. So it's just like it sounds. Variability is very low when you actually get the same score. Now let's say you do the test again, and you do 200 is your first result, and then 150, 250, 300, 175. And this is all during that one test where normally there's about 10 trials. Normally there's 10 trials. There's some variation for different people, but normally there's 10 trials. And if these numbers are all over the place, then the variability is high. Now, what causes that variability is a question you want to ask. And, so if, let's say there's somebody's taking the test in a waiting room and there's a lot going on and people are running in and out and pots and pans are clanging and, a lot of people are yelling, maybe their reaction time variability would be high. Or it could just be somebody with ADHD who is off their meds. You really don't know. I mean, but that's the thing you need to take into context, because it does give you an idea about how their performance on the rest of the test. Because if their focus score is low, really, really low, then it can be very bad. I mentioned the normative values are 5 to 20. So ADHD kids are usually really high in the 70 to 100 millisecond range. But, mild concussion, we see people bounce up to about 30 milliseconds. But let's see, what else affects, what kinds of things do you see increases in reaction time variability or decreases in the focus score? Well, things obviously, dementia and Alzheimer's, you have trouble paying attention. ADHD, again, we've seen people do this test with and without their ADHD drugs. Huge difference. People with autism and lesions, and their list goes on and on. Again, if you have poor reaction time variability, it does not mean you have a neurodegenerative disorder or that you have a TBI. But the thing to think about in terms of this is really symptomatic of poor focus or attention, which makes sense if you have an increase in reaction time variability. So multitasking or any distraction will make those scores go up. And another thing that makes that really does impact the score is stress and anxiety. Emotional. There's an emotional impact on the score. If people are very stressed, very anxious, they typically don't do well on the focus score. So one quick addendum on here is let's take a look at the timing accuracy of the brain gauge. And the timing accuracy of the brain gauge, the modern brain gauge, is 0.3 milliseconds. And what did I just mention? I just said normative range is 5 to 20 milliseconds. And we see a lot of people in that 5 to 10 millisecond range now. So that's very, very good. Visual reaction time with the USB mouse. What that means is you sit down at any computer with a mouse, it's got a reaction time variability on a good day of about 40 milliseconds. This is on top of another latency that's really bad. So the variability error far exceeds what the normative values are. And like I mentioned, a lot of times, it'll just pop up from 10, say to 30 or 40 milliseconds. Well, you can't measure a teaspoon with a gallon jug. It's that simple. And forget doing it with a touchscreen. I mean, that just really doesn't work because there are inherent delays. And if you want to learn more about these errors and the accuracy of the brain gauge, then go to the reaction time accuracy talk on the science section. So anyway, thanks for watching and hope that helps. If you have any other questions, please feel free to reach out.